Now, Professor Evgenya will speak about insulin resistance, obesity, and the cardiometabolic risk in adolescents.
Dear colleagues, do you hear me well enough? Yeah, thank you for staying here during all the day and during the evening. Before I will start the talk about obesity in adolescents, I would like to ask you, who of you are working with adolescents? One person. And what is your opinion? Is it the difficult population or the easiest one? Difficult. Yeah, it's the main question here. So it will be a talk not about all possibilities in treatment of obesity. It will just sharing of my philosophy of viewing how to work with such population, because sometimes it's very, very difficult. Again, I would ask you to give me email if you want presentation or something from this presentation, and my email is written here. So the main problem is that we have so many adolescents with obesity now, and for sure the amount of this population will be grown as women with obesity, men with obesity, but adolescents for sure is a more problematic population than other, not only because of some psychological difficulties, and we will discuss it later, but also because a lot of obesogenic factors which can influence on obesity in this population. There are so many factors around them, not only sedentary lifestyle, but also something about food intake, also about social intervention, everything around school, and everything about interaction between parents and children. So many factors which are very difficult to achieve in a good way working with obesity. And of course, the previous speakers perfectly describes all things around what can help, what will happen to this patient with obesity. But for adolescents, during their life, it can be more and more influenced with all these things which are written here. Of course, the other important issue is that we need to move here very quickly, because the influence of obesity during all that time will be increasing during years after years. How we can use these charts to diagnose the obesity? It's easier for pediatricians, maybe for doctors working only with the charts, it looks like a little bit difficult, but for us as pediatric endocrinologists, it's not very difficult, but the diagnosis is not so difficult. It's difficult to understand what's going on during physically inactive persons and how it can work with pro-inflammatory status of such patients. Here I can just remind you that also we have to remember not about biological factors, but also about behavioral factors, and life of every adolescent is full of stress. Not only because of difficult relationship with everyone, but also due to some natural things around stress, and of course the amount of diseases and conditions caused or aggravated by obesity during adolescence is huge. Here I just want to put your attention not only on these diseases, which all previous speakers discussed perfectly, but again to psychological and social issues which are very important for all adolescents who are obese. Another option here is that it's very difficult to be adolescents and to be sick adolescents. That's why all publications around their comorbidities are very strict in their desire to improve weight in this population. There are some publications about low back pain in adolescents with obesity. They suffer from it. Of course, in this age, it's not very easy to move slowly during these situations. They need our helps during all these acute pain periods. And of course, if we are talking about long-term effects of obesity in adolescents, we need to remember about not only risk factors, and we need to remember not how to work with risk factors. We need to remember about mechanism for pediatric obesity And we need to put our attention to long-term consequences, which are huge in amount. Here is another option which are not very often discussed during the medical conferences or during publications. Of course, some of these obese adolescents, they have micronutrient monitoring process needed because all of them are suffering from some deficiencies, and we as clinicians need to remember about it and put our attention not only, I don't know, about kilograms of weight, glucose control, something about cholesterol level, but also to micronutrients, which are very important in this stage of age. Also, for working with adolescents, it's very important what we can ask for these patients. And it's not only a general history. We need to remember about weight and its development. We need about think about growth processes, about not only about personal history, but also about family history, which we need to discuss, about gestational diabetes in mothers, and we discussed it yesterday during the conference. Of course, there are some lifestyle factors, diet, and you can imagine the diet of adolescents all over the world, not only, I think not only in Qatar, in Egypt and Russia, adolescents have some special way to eat. Of course, we need about breakfast, lunch, dinners, about physical activity, and honestly speaking, about physical inactivity. Sometimes we need to ask very perfectly about lifestyle and sedentary type of lifestyle. And here, of course, there are some very important issues, not only about observation and asking questions, but also about physical examination in adolescents with obesity. And again, I would stress that and emphasize that not only weight here is important. There are a lot of things that you need to discover here, and we need to discuss with the patient and the family, of course. We need to suggest some screening for comorbidities, and it's very important in this population, and as I told you before. And I just want to add here that sometimes we don't remember about sleep here, and our adolescents can, during their so-called sleep time, do whatever they want, but for now it's understandable that important sleep in this age is very great, so sleep deprivation results in changes not only in appetite, but also in some hormone levels. There is simple evidence to support the relationship between sleep deprivation, sleep problems, and childhood obesity. There are a lot of publications about it. It's not just the duration, but also the quality of sleep that matter, and later sleep things are also associated with obesogenic behaviors in children and would contribute to obesity. Please remember about it when you are asking your patients and trying to help them, because it's very important. Of course, the risk reduction of few diseases depends on when weight loss is achieved. So we must do as soon as possible and do everything we can do for such population. And what can also be discussed with our patients besides the treatment and strategy of physical examination or asking questions about family history and about history of the person. Of course, the main issue here is obesity prevention. But what we can discuss here with our patients, of course, we need to remember that urban planning is very important here. We need to improve and be attentive to mass media campaigns against obesity in adolescents, because prevention here is the key, not only education. We need to remember about necessity of reduction in junk food. Is it usual for your adolescents here to eat everything they want to eat? In Russia is a huge problem. Of course, school-based program combining nutrition, physical education, skill building, and policy changes are necessary. Providing unhealthy food from school, countries are vending machines, because it's still a problem in my country. I don't know how patients have they eaten during school days in your countries, but I think the problem is very close everywhere. The provision of a community-based strategy to inform people on healthy eating and physical activity. And I think here we need to remember that we ourselves have to be an example for our patients, especially for adolescents with obesity. Of course, we need to remind our patient about waist circumference, about BMI index. We need to action to alter the cost of healthy choice because sometimes it's very expensive. The provision of informed concern to people of labeling food products and restaurant menus is also important, and we're trying to put attention in my country now to this process. And of course, we can do anything because in some countries there are good examples for working with in obesity prevention is in such population. What we can do with adolescents who are obese? Of course, we need to remember about dietary factors which can influence in insulin resistance and reason for obesity in adolescents. And here, again, it's not only diet with carbohydrates amount or fat or protein amount, it's also important to remember about macronutrients. And of course, again, after dietitian consultation, after physical examination emphasizing, we need to remember there is still some drugs which is possible to use even in adolescents. And here we need to stop this clinical inertia which we are waiting for years when our adolescent will lose weight her or himself with physical activity or inactivity. So there are some guidelines with a lot of information about drugs, and there are some treatment options here. But how do you think, what is the main problem with treatment possibilities in obese adolescent? Will they follow our recommendations? Will they remember about our recommendations? The main problem here is there are some key developmental tasks of adolescents from psychological point of view, and the first one is separating from parents, and the second one is becoming an individual able to independently form opinions, ideas, and goals. And us as clinicians, together with parents, are such old ideals for our adolescents. So sometimes it's easier to discuss something from their peers' side than from a position of the authority for these patients. And of course, adolescents are interested in becoming more independent from their parents, and independence in diabetes care, in obesity care is part of that. So don't have any illusions about drugs for obese patients and adolescents, because they, honestly speaking, they will not always be very enthusiastic in this. And another point of view from psychological sphere is also with comorbidities from the point of depression and from the point of eating disorders. It's also a huge problem in adolescents, especially in obese adolescents. And here I just want to stress that obesity is complex, and there really structured approach is needed with consultancy with dietitians, physical activity trainers, of course psychologists, with co-workers as parents, and together we can do something with obese adolescents. Of course, we have clinical algorithm for obese adolescents, and for now it's understandable that we need to go step by step, working with clinical inertia, trying to put all our attention to everything around obese adolescent. And of course, we are worrying about type 2 diabetes in this population. Of course, we have some ISPAT guideline now for this population, and easier to work with that because more and more obese adolescents become patients with type 2 diabetes who are very difficult to treat. But still, just the main conclusion is that obesity is a disease and should be managed as such a disease, not just fat boy or fat girl, not just something about simple conversation in clinic that please lose weight. Is a disease, and we here must work with obesity as a disease. First diagnostic, with all the steps which we discussed, with all examination, with all thoughts about all comorbidity and all dangerous things around obesity in adolescents, and after then treat. Not only with drugs, but also working with psychologists, dietitian, and physical trainer. Thank you for your attention, and I hope for some questions.